I'd like to welcome and introduce Dr. Robert Murphy, who is the Executive Director of the Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions each Tuesday and Thursday on the Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions that we've received through the 24th of August. And we invite you to continue to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion today is Vinay Derbakula, an intern this summer with the Institute. So Vinay, I now turn it over to you.
Thank you, Kristen. Really excited to be here. And thank you to everyone who continues to submit questions and watch. So we'll start today with some major headlines. The first one is just comparing the Illinois positivity rate per day to other states. Illinois is actually doing quite well. We get 3,541 positive cases per day, but then looking at states like Florida, which have 21,329 cases per day, and Texas, which have 17,000 cases per day, significant decrease for Illinois. But the biggest headline of the week comes from the FDA granting the full approval of the Pfizer 2-dose vaccine. Dr. Murphy, what are your thoughts on this?
Yeah, well, it's been about a year since the end of the clinical trials with the Pfizer vaccine, approximately a year. And they have all the data of the many 30 to 40,000 people that were in those studies. They followed them. Plus, once the vaccine was approved in December 2020, they have all the clinical data that they've gathered from that release and multiple studies that have been done on those patients. So this is a huge milestone that they have full approval. They get to call it a name. They have different kind of marketing rules that they can follow and can advertise the drug and other things. Still, the drug control in the United States is completely run by the government because the government has purchased all the doses. Now that may change over time, but this is really a milestone, and it shows you that the FDA, who's one of the strictest regulatory agencies in the world, has given this vaccine full approval for people 16 years and up. So this is truly remarkable, and it's going to really affect a lot of people in two ways. One is that a lot of people felt hesitant. I thought maybe unnecessarily so, but I mean, they didn't feel comfortable with the emergency use authorization that the vaccine had until now. And so I think some people, that may encourage people to get vaccinated. The other thing is that with this full approval, I think the companies and institutions are going to really have carte blanche now to mandate vaccines if they think it's safe for their employees or customers or students or whoever they're working with, all the stakeholders. And so that's a huge thing. And you're going to see, I think, an avalanche of mandates coming forward.
So on that topic, several hospitals around the country in the Illinois, Chicago area have begun to mandate vaccinations. However, Northwestern Memorial Hospital has not. Why do you think that is?
Well, not every hospital system has mandated the vaccines. However, here in Chicago, Rush, the University of Illinois, the University of Chicago, North Shore, have all, and several other groups, 134 in the United States altogether. I mean, including Harvard, Penn, Emory, Stanford, and the entire state of New York has mandated all healthcare workers have to be vaccinated. Kaiser Permanente has mandated it as well, and the Veterans Administration, a huge provider of healthcare. So, it's coming. I asked the leadership here at Northwestern, and apparently they're working on a plan. I actually work for the university. I don't work for the hospital, but they actually gave me a contact. And if anyone has any question for that, because we did get some questions about this, possibly from some employees, that you can contact Christopher King. That's christopher.king@nm.org. And he is very happy to take your questions. And I'm sure there's some plan in the works, but it just hasn't happened yet. But it's happening elsewhere in other institutions as well, and other companies as well. For instance, the Archdiocese of Chicago has mandated all the people that work for the Archdiocese, including all the schools, have to be vaccinated. And interestingly, no religious exemptions are allowed from the Archdiocese. So I give them credit for that. It's a really strong statement. And I think they've really taken the right step.
That's awesome. One other question tying to this headline. How do you think this will impact the COVID booster shots? Does this vaccination approval go along with that, or is that a separate thing?
It's actually a separate thing, but first things first. One is that we use the terms, the EUA, emergency use authorization, and full approval, and then we use the booster shots and third doses. So let me just clarify that a little bit because it is a little bit confusing. The full approval is for the 2 vaccine doses that everybody gets right off the bat that wants to take a vaccine. That's the full approval. Everything else remains emergency use authorization. All right. So that means that a booster dose, which is 1 shot, it's the same vaccine, it's the same thing you had before, same dose, same administration, everything, that is now recommended or going to be recommended for everybody 8 months after their second dose. So that's going to start in September. And the EUA will be extended to that booster dose. Some people are doing it already. They've already figured out how to get another dose. And the recommendation is to take the same vaccine that you had the first time, either the Pfizer or Moderna, but they even say, if you can't get that one, take the other one. Yeah. Just do it. Now, there's another group of people that have EUA approval, and that's people who are immunocompromised. They're taking steroids or some immunosuppressant. They have underlying cancer on chemotherapy. They had an organ transplant, like a kidney transplant or liver transplant, and they're taking all sorts of medications to keep that organ. Those people do not mount a very strong response if they mount any response at all. So they got approval, emergency use authorization, to take a third dose of the vaccine, just so that they get a response. So it's the same, again, it's the same vaccine, intramuscular, whatever, just an extra dose. Now, some of those people may actually need a 4th dose or a 5th dose. That remains to be seen. But those are EUA approvals, and one is a booster and one is just a 3rd shot. But it's semantics. It's really kind of all the same.
Got it. Makes sense. That answers a couple of questions on our user segment. But now we'll head on to the viewer-based questions. We'll start it off with one viewer mentions the CDC statement about how if someone who is vaccinated has been exposed to someone who is tested positive, they should be waiting 3 to 5 days before testing, or it could be too early and potentially result in a false negative. But in those 3 to 5 days, those people who are trying to test have been recommended that they can go to work. Is that going to cause any exposure problems, or what should the people do in that 3 to 5 day period when they're attending their various professions?
The exposures now, they're not ill. We don't know if they're going to get sick. Of course, if they go anywhere, they've got to wear a mask around anybody, but they should really be in quarantine until they have a negative test. We're going backwards in the recommendations now because this Delta variant is so contagious. And so if you have a test, then at 7 days, pretty much you're free and clear. You're out of quarantine. You go back to your normal behavior. All right. And then the actual full quarantine for somebody who is infected, even or exposed, is actually 10 days. And if you actually do have COVID, you need to quarantine for a little bit longer or be careful around other people around you who are immunosuppressed. And so that extends it back out to 14 days is the thing. But the one thing about it is, even if you've been infected, you don't have to follow up with another test. That is not going to be helpful. Just use those dates, 10 days, and then if you're around immunocompromised, 14 days.
Got it. Okay, that makes perfect sense. Another question that was asked pretty frequently was the difference and the effectiveness between the Pfizer vaccine and the Moderna vaccine against this new Delta variant. And so there's obviously a lot of studies out there. What do you have to say about the results from those studies?
Well, there have been multiple small studies comparing what happens with Delta virus and those vaccines. And some have shown that the overall response is a little bit less for both of them, like 10 points less, but still it holds up pretty well in the metric that we measure, that is getting in the hospital, serious illness or death. So those are holding pretty good. And the ones that end up in the hospital or do die typically are people at very high risk. You know, they're older, maybe they have underlying cardiac disease or lung disease, they have something else going on. It's typically not the younger people. It's those, the younger people that are getting infected now are the unvaccinated. I mean, that are getting seriously ill are the unvaccinated ones. They're the ones that are in the ICUs in Florida and Texas and anywhere where people aren't taking the vaccine. Now, in one study, it was shown that the Pfizer vaccine did relatively poorly. I think this was the Mayo Clinic study, where I think it was 39% effective. That's just one study, and it doesn't match up with the other ones. I would take it with a grain of salt at this particular point. But it also brings up the whole thing about boosters. You know, these vaccines look like they begin losing their efficacy at about 8 months. And so people should get the booster.
Got it. The next question talks about, obviously with this new Delta variant, people have begun to get COVID, and those are people who have had it in the past. Is there any difference in the reinfection rate between people who are vaccinated and those who are unvaccinated?
Oh, yes. So reinfection was pretty rare and usually doesn't happen until after a few months. But we noticed this from the very beginning of the pandemic, that people started getting COVID again. If you look at big groups of population, the reinfection rate is 2 to 3 times higher in the unvaccinated versus the vaccinated. Wow. So it's just yet another reason to take the vaccine.
Wow. Okay. Well, that's a big difference.
Mm-hmm.
The next question comes from someone who mentions that their 25-year-old perfectly healthy son's hair had started falling out a week after they got the Johnson & Johnson vaccine. The doctors and dermatologists mentioned that Johnson & Johnson may cause some autoimmune issues. Wondering what the, I guess, data says about the Johnson & Johnson vaccine and its effects after the fact.
I haven't heard this as being a common side effect. It may or may not be related. We know that Guillain-Barré is associated with this, that neurologic paralysis syndrome, and also Bell's palsy, paralysis of half the face, is also more common after the Johnson & Johnson vaccine. Still, it's very, very rare. Not very many people, but it's coming up more than it should, because these things just happen out there. It's not like they don't ever happen. In the case of this person losing the hair, I think it's very important that that person either personally or have their doctor fill out a VAERS report, VAERS report from the FDA. It can be downloaded from the FDA website. It's a vaccine adverse event reporting form, and anybody can fill that out. You don't even have to be a doctor to fill it out and mail it in, but have somebody that can actually fill it out and put all the technical stuff in there. And I think it's important that these kind of unusual side effects are reported to the FDA, because they will collect them, and that becomes public information. So if we don't report these kind of unusual side effects, we'll never really know if this is really associated with the vaccine or not. So please report that. I think that's a good example of how the public can help everybody.
Perfect. Always new data coming out, always helpful to report. Then another person asks about just maybe getting an update on where we are in our COVID research. when we first started, in terms of mitigation efforts, we had mentioned that it was very possible for COVID to pass through contaminated surfaces. And so one person mentions a very specific example from Oak Park, talking very specifically about a farmer's market and picking up and putting down produce being not allowed in certain places. And they were just kind of wondering, what is the reason for this? Is this still necessary precaution to be taking?
Yeah, things have evolved over the course of the pandemic. We've learned a lot. At the beginning, we thought that 6% of all the infections were transmitted through the environment. If you remember at the beginning, I mean, people were washing everything, doorknobs, everything, any telephones, and all of this stuff. It turns out that was probably an overestimate. It's not like it can't happen, but 6% was way too high. It's basically all of this respiratory, and whether the particles aerosolize, go float around a room, or it stays in the droplet. It's mostly droplet transmitted, but it can aerosolize. So the environmental risk is much, much lower. However, it's not zero. So I think, if the purveyor, if the venue doesn't want you to touch stuff, don't touch it unless you're going to buy it. I think that's up to them. I don't think it's a bad thing, but I don't think we have to be as concerned as we were before.
Got it. One other question that the viewers had mentioned was, again, kind of tying back to the last question in just updating COVID procedures. Someone who is in a household who tests positive where other people in the household have already tested positive, does that person still need to isolate and do all the measures that we had mentioned in the past?
Yes, unfortunately. We've gone backwards on this, and that, because you can get reinfected, and, unfortunately, yes.
Got it. And then our last question of the day comes from someone who is expected to travel with a trainee who is unvaccinated. The person who is traveling is vaccinated, the trainee is unvaccinated. And so the person is just wondering how safe that they are in terms of traveling with the unvaccinated person.
Yeah, this is a very practical question. It comes up a lot in companies, in all the different contexts that companies can have. This is very dangerous. Delta is so contagious that it's really very high risk. It's high risk to the partner, the working collaborator, and it's high risk to the customers they're coming in contact with. So this should not be done. This person should not be out facing the public unvaccinated. And it's up to the company to actually put the policy in place. And many of them have done it. Some of the big commercial corporate meat manufacturers and processors have mandated that all the employees have to be vaccinated. Company after company after company has been mandating it because the infection rate is so high that half the workforce, not half, but I mean huge chunks of the workforce are on quarantine half the time and can't even work. I mean they basically, it's difficult to function. Same thing with universities. The universities are mandating, many of the universities are mandating vaccination because how do you run school with the teachers out or this one out or half the class is not there or whatever, and how do you get them back in? That's a whole process. So the schools, especially the colleges and universities have done it. Many of the corporations have done it. Many of the big companies, Google has done it, and Apple. And you're going to see company after company after company put these mandates in place. And where this person works here, that company should do the same thing.
Got it. Well, thank you so much, Dr. Murphy. That's all the questions we have for today. Yeah.
All right. We'll see you Thursday, Vinay. Thank you.
All right. Awesome. Bye.